Okay, Dr. Batsides. So yesterday was your first day here in Lagos operating. Can you tell me a little bit about what your experience was in surgery here yesterday?
Overall, it's an amazing experience. I would say the first thing that stands out is the team's dedication. The team completely came together. Somewhat not optimal circumstances for the operating room, lighting, suction, heart-lung machine issues earlier in the week, but everyone came together as a team. Really went seamlessly. I was really impressed with the dedication of everyone, and also the dedication not only of our staff here, but the team here at Lagos and the nurses. Really outstanding care through and through, despite some pretty impressive challenges.
What would you say are the most important things that we would need here to give the care that you think patients here would deserve and benefit from?
You know, simple things that we take for granted in the States, certain cell-saver suction devices, having enough supplies, and not having to kind of piecemeal operations together. You even worry about simple things like sutures. So everyone that came brought supplies from their hospitals, and the Boom Foundation does an amazing job of bringing in supplies from around the U.S. and the country. But it'd be nice to see that we could set up a supply chain here so these hospitals and these patients can get what's needed. As far as the intraoperative things, it'd be nice to have some better air quality or coolness in the operating room. It would be nice to have better suction devices and lighting. I think those are the things. So the electrical issues are going to be an issue clearly, but these are things that you can overcome. And the team definitely has to get creative at times from what I can see. Again, only doing one operation here so far, but thankfully everything went well, and the patients do phenomenally well here. And that has a lot to do with the dedication to the team that's left here. And just finishing rounds now, seeing how they make rounds has really stood out and impressed me. Just a very thorough rounding process, including the nurse, the entire team, extremely multidisciplinary. Things that we could potentially improve would be some medications, and again, the use of some instruments that could be not just brought, but that the hospitals would have here and could maintain here.
And what do you think this work means for people here in Nigeria?
I think it's excellent work. Looking at the numbers and talking to the lead surgeon here, the numbers have gone up exponentially, and they're doing over 100-something cases now a year. It seems like 150 or almost 200 in the country. But really, what you need to kind of establish this is going to be lead surgeons here, trained surgeons that can work with U.S. teams, European teams, teams from India, and then eventually get up and run fully on their own. So it's going to take a dedication from the surgeons here. I think it's going to take a dedication that's absolutely necessary from the country and from the government. They have to assist in this because there's a lot of people here, from what I can see, that need care. And it really has to come from the top down. And not only the government, the hospital administration there has to be a buy-in. Ultimately, it can't be completely about finances. I know finances are important to run institutions, but you have to establish a good heart program at these few locations, and if you establish a good heart program, those institutions, I believe, will have a halo effect in the institution, and they'll get more patients coming, more people will be understanding that heart surgery can be done, and you'll get more people who are seeking care. And then ultimately, this could take off, and it needs to take off because there's thousands, hundreds of thousands of people here that could benefit from the services.
Thank you, Dr.
Thank you.
Batsides.